and also thank you, Jude, and the rest of the team for putting this together. We're very pleased to be here to be able to talk about this topic. I've just started in terms of the slides. I'm currently, the university, as some of you will know, is looking at decolonising some of its logos. So I'm just sharing the logo that some of us are using at the moment because I'm aware that I've got a logo behind me on the Zoom background that hasn't been blanked out. So just to flag that to you. Next slide, please. So as Rich said, we've already been doing some work on this topic. I think the first time, when I first started doing my own PhD in the mid-90s, this was an issue that we were aware of then, people who'd done research in the area of gender-based violence, domestic violence research in particular. Many of us had come from working in frontline domestic abuse services, so we were aware of what support was available to frontline practitioners, and also aware when we went into a research environment that that wasn't often available. And we earlier this year published a paper which was based on quite a large-scale project that we did, looking at the impact of research in gender-based violence on researchers and looking at secondary trauma and emotional safety. So I think you've had access to that paper, and what I'm going to be talking about today draws on some of the key themes from that. Before I'm then going to hand over to Alison, who's going to look specifically at what some of the additional issues that have arisen during COVID and things that we might need to think about in the future. Next slide, please. Thank you. So the key things I want to talk about today are trigger points, cumulative impacts, competing demands, coping mechanisms, and the potential to make a difference. So I'm going to talk in more detail about the two that have asterisks there, but just to mention the others, I think there's some important points to make. I'm going to start with the last point there, which is we are very privileged to be able to do the work that we do, and there are some very positive impacts of doing work in this area. And I think, you know, we all recognise that we are able in many situations to make changes in society, in policy that impacts on victims and survivors and families. And that's really important because that often is why we do the work that we do. So anything that I'm saying today doesn't take away from that, but I think it's important alongside that to look at why we do what we do, at some of the difficulties that arise. So when we talk about trigger points, we're talking about different aspects of research that can be problematic for individuals. And that might be something related to a particular topic, a particular idea that somebody raises in an interview, for example, or something that comes up in case studies, case files. And I think the key thing to say there is that we don't always know what the trigger points of research are going to be. So one of the things when we're talking about how we can practically deal with some of the problems that we're talking about is it's very difficult, as it is in identifying any kind of risk, doing risk analysis before the event, to identify what all of the trigger points might be. But as individuals, it's important to try and think about what they might be, but also collectively we need to look at that. And that doesn't mean just in relation to qualitative research. So we have colleagues who've done quantitative research, and also literature reviews can be quite stressful if you're reading pretty awful traumatic details day in, day out, can be cumulatively quite difficult. In terms of the cumulative impact, that can be about the intensity of a particular project, but also I think one of the things that's come out from talking to researchers who've been doing this work for a long time is there is an idea that after you've done it for a few years, it somehow gets easier. And actually that isn't always the case. For some people, it gets harder. And part of that is because, you know, it might take a long time to enact change with the findings of your research, the impact work that you might be doing, that actually that can be quite tiring, quite draining. And sometimes people do get to a point, might call it burnout. Some of the literature around burnout is relevant when we're talking about researchers. But again, we need to bear in mind that it isn't just an issue of experience there. Experience can be both a positive and negative thing in terms of coping with some of the issues of this kind of work. I'm going to go on to competing demands and coping mechanisms now. So next slide, please. Okay, so the key thing here that I wanted to flag up is when we're talking about some of the difficulties of doing this research, we have to recognise that we're having that conversation in a context where there is a lot of pressure to get the job done. So if you're employed as a researcher to do a certain number of interviews, there is pressure to do those interviews and get them done, and that can make it difficult sometimes to then build into that process enough space for you to be able to recognize when you might need to step back, or recognize when you need to enact some of the coping strategies, both individual but also structural, I think, in terms of institutions and their responsibilities. So I think we absolutely recognize that is an issue. So when we're saying, oh, today we might come up with ideas about how we can make things better or easier, we are absolutely acutely aware that that is extremely difficult to do when you're within a situation where you may not want to talk to your line manager because you're on an insecure contract, where you may have pressure from your PhD supervisor to just get on with it, partly because they want you to do it, they want you to complete the work you're doing, but also trying to balance those things out. And I think we don't have enough conversation about how we balance those sometimes competing demands. The second thing, though, is around boundaries of work and home. Now, I know Alison's going to talk a little bit about some of those physical barriers and mental barriers in relation to that. The point I wanted to make here is that we all have different identities. So I'm here as a researcher today. Sometimes I'm a manager. I'm also a survivor myself. I'm somebody who's worked closely with the NGO sector. And those identities and how we perceive the impacts of the work we're doing around trauma, I think we have to recognise that we're not just talking about something that happens to other people, that we are somehow coming in and looking at and we might be affected by. We might also have those traumas from our own experiences. And again, I think that is something in relation to the boundaries between work and home that it's important to think about. And I think whether we like it or not, a lot of us don't like it. We do work in an academic environment that looks down on weakness, and because of the way that contracts are structured, it can be very difficult for people to actually have honest conversations about how they're feeling if they don't want to. I've put look weak. I'm not suggesting it is weakness, but I think that is sometimes the fear. When Alison and I did a presentation on this topic at a European conference, somebody actually said, well, really, you just got to suck it up. You've just got to get on with it. And that is the expectation, I think, and has been for a long time. So it's important to start having these conversations to look at, well, how that isn't acceptable. What can we do to address that? Next slide, please. So coping strategies. I think, first of all, we need to recognise there are healthy and unhealthy ones. In the paper, we list a number of strategies that my colleagues and I have used over the years. I particularly like reading detective fiction, primarily because in those books the baddie gets it, and often in the work that we do the baddie doesn't get it. So I find that quite a healthy way to deal with it. Some of us drink too much when we're doing lots of horrible interviews, which isn't healthy. So I think recognizing that there are different coping strategies, just because it's unhealthy doesn't mean it isn't a coping strategy. It just might mean that we need to look at, or individuals and with the help of other people might need to look at how they can perhaps use other ways. I think it's also important to be proactive. So the way that it currently works is if you're having issues with research as a researcher, we'll be referred to staff or student counselling, and that is reactive. And what I think we're increasingly calling for is a proactive approach where individuals can actually see a clinical supervisor, counsellor, in order to work out before they do the research what the trigger points might be for them, what their coping strategies might be, and how they're going to manage that. And again, I'm not suggesting that that is just an individual responsibility. I think that's a responsibility across the board. For us as academics and academic institutions, but it is really important to look at, in a proactive way, what we can do for ourselves, but also what we need from others in order to do that. So I've listed there staff student counselling. We think clinical supervision is really important. As employees of university, you also have occupational health health and safety, and sorry, I set my own alarm there, which is fine. Occupational health, health and safety, but also research ethics committees, I think, play a really important role, which is partly why I have an interest in research ethics around researcher safety protocols. And those researcher safety protocols should always consider emotional safety. And I think very often we don't do that. We talk about the emotional safety of participants, but it's really important to think about researcher safety in relation to that as well. I have to do it if I'm going into somebody's house to make sure I'm physically safe. But if nobody asks, well, actually you're going in that house, which is physically safe, to talk about really awful things that are very traumatic, how are you going to emotionally manage that when you come out? And again, I think too often we don't have those conversations. I'm very lucky. I work in a centre that's been going for a long time, 30 years. Everybody's very experienced, so we do have those conversations, but I know how difficult it is for colleagues who are isolated in their institution, and particularly for PhD students who'll be working on their own often, and may feel that they're having to deal with it on their own. So I think as a collective community we need to start addressing those issues. Next slide, please. So I'm going to finish now, and I'm going to hand over to Alison, who's going to talk about some of the things I've just mentioned, but what happens when you're trying to deal with all that and all of a sudden you find yourself in a global pandemic. So over to you, Alison. Thank you.
Thanks very much, Emma. Good afternoon, everybody. As Rich has said, I'm Alison Gregory. I'm a research fellow at Bristol Medical School. And like Emma, I predominantly research domestic and sexual violence and abuse. So it's from that perspective that I'll be talking today about what it's like to conduct sensitive research during a pandemic. But just to say that much of what I'll be saying and what Emma's been saying is related to any number of different topics. You may be researching mental health, you may be researching suicide, childhood deaths, palliative care, gang violence. I mean, the whole list goes on of the kind of topics that might be tricky. In fact, because you never quite know what's going to come up in a qualitative interview, when you give somebody kind of time and space to talk, even if you're working on a seemingly kind of fairly straightforward topic and you're not expecting kind of difficult material to arise, actually you may end up finding yourself hearing information or witnessing people's distress or actions that you might find difficult to process. And as Emma has indicated, this is a subject that we, oh, next slide, please. Forgot to say, thank you. As Emma has indicated, this is a subject we'd already been working on, we'd already been interested in and writing about prior to the point when COVID hit. So what has changed and what are the additional challenges this has presented to us? And I think most of us would agree that quite a lot has changed. I mean, certainly as I was gathering up my kind of kit from my office to come home, I wasn't expecting to still be here at the end of July, and I wasn't expecting the changes to be as large as they have been. So listed here are some of the things I'm going to briefly talk around. And as you can see, it's not just about how we work as researchers, which I'll come on to, but it's also about what's changed in terms of the context that we're trying to conduct research within, and also the demands on us outside of work. Next slide, please. Thank you. So thinking about the research context, for Emma and I, our field is gender-based violence, and no doubt you will have seen some of these headlines indicating that there's been a rise in domestic abuse, there's been a rise in the deaths related to abuse, whether femicides or suicides, and an increase on specialist services as a result of that, and also COVID itself being used as a way to abuse other people. But whatever field you're working in, the landscape of your life and the landscape of the lives that people you will be conducting research with will necessarily have changed. And this will change how you conduct the research, but it will also change how you think about and feel about the research you're doing. So for me, I saw these headlines, and whilst they're not at all unexpected for those of us that work in the field, they did cause a heart sink moment. And if I'm honest, there was a point where I felt a bit hopeless about it all. You know, like, what I'm doing is a drop in the ocean. Am I just fighting a lost battle here? Thankfully, those feelings passed as I worked out ways to continue with the research. And instead, I've found ways also of kind of best making the research that I do work at this moment in time. And what I mean by that is that it's having real world impact. And that's part of how I suppose I've coped, knowing that the research I do actually changes things. Next slide, please. So this changing landscape and context has made Emma and I and our colleagues think very hard about the appropriateness of conducting research during this period. We've had to ask ourselves questions about whether we're putting people in a position of increased risk by asking them to participate in studies both during this time, but also to participate from their own home. Of course, it's absolutely paramount for us as researchers that we're able to kind of accurately evaluate participants' welfare, but interviewing by phone or online allows us no way of knowing really who else is in the room, who else is listening. Perhaps we have slightly less indication of how the participant is doing. And we recognise in our field of work that we have very little control over the participants' environment, and they may well not have much control over their environment either. And certainly I've been doing some interviews in my case there at the moment with friends and family members of domestic violence survivors, where I've thought the people were alone, and then suddenly somebody has walked through from one room behind the person in, you know, to go through another door. And in one case, I was talking to a participant, I'd asked her a question and she turned and asked the person next to her what they thought. I had no idea that there was a second person there. The second issue we've been thinking about is whether taking part in the research is more emotionally upsetting, demanding for people at the moment. All of us are more tired, all of us are more emotionally drained, and being asked about a topic which is sensitive, emotive, potentially distressing could be harder for people just now. We've also been thinking about, given concerns about the virus disproportionately impacting communities already experiencing inequalities, whether online technologies will work for these different groups and whether participants can access the means to connect. We're trying to create a kind of an equity of access to research, but that's a bit of a challenge at the moment. And in terms of research structure and thinking about qualitative methods, particularly our interviews and my colleagues' interviews too, conducted during lockdown have been longer. And we think that's for a variety of reasons. In part because we think people have got more thinking time, particularly with the very initial stages of lockdown. People thought in advance about what they wanted to say in the research interview, what they wanted to kind of get across. People also, I think, probably feel more confident and more comfortable talking from their own homes. And that's another reason why they're perhaps talking in more depth. But also some of our participants were clearly using the interviews as valuable human interaction when they weren't seeing as many people as they normally would, including talking to us about pandemic-related issues too, you know, if they had any particular symptoms or any particular struggles with managing to get out and about safely at that moment in time. And this links to the question about whether people found it more upsetting, more distressing to take part in research during this time. And certainly from my own experience, I asked people how it's been, and from my own observations of conducting interviews, the indications from participants so far have been that people have actually really valued the fact that the research has continued and that they've had space to talk. Some of them have become upset during interviews, and that's not unusual given the topic that we're talking about. But actually, they haven't necessarily seen that as a negative thing. They've found the expression, I suppose, of emotion actually quite a useful thing to do. And finally, perhaps one of the most positive aspects we found of working from our own homes during the pandemic for participants is the kind of leveller of you're both sat in your own home, you can both see each other's wallpaper behind. So instead of it being a professional and a participant and kind of seeing people against a kind of a blank canvas, I suppose, of a community setting or of a university building, actually you're kind of on a level playing field. So it feels like it's easier to develop rapport with people and to make connection. Next slide, please. And those are some of the things that we've been thinking about whilst conducting this research during lockdown, but how are researchers themselves doing? And these are a few of the words that I've noticed my colleagues using in the past couple of months. So why are we feeling like this? Why are we feeling rocky? Why are we feeling delicate, unhinged, and a bit screamy at times? Next slide, please. Well, from my own experience, I think there are a number of reasons, some of which I'll mention, but I'm sure more will come up in the discussion. The first is around the burden of using technology. There's something about the combination of trying to remember everything you need to do technology-wise, whilst being observed by the person you're trying to do it with, and trying to have a really sensitive conversation that's really demanding. It feels like you're using your left and right side of your brain simultaneously and in quite kind of high demand. In particular, colleagues have expressed their anxiety and concerns about what happens if the internet connection goes down, particularly if the person's right in the middle of disclosing something difficult or experiencing a higher level of emotion. And certainly something to think about yourselves as researchers in terms of how it impacts on you is whether this is an appropriate population to use online methods with. And what I mean by that is I have some colleagues who are doing work, research with perpetrators at the moment, and actually from their experience, sometimes using online technologies, the people that they're speaking to are using those technologies in a way to try to exert some control over the researchers. We can talk more in depth about that, but it's just something to flag up really, to think about whether the population is appropriate for them to conduct the research using online methods, but also for you to conduct the research using online methods. The second is one of my own experiences, and this is about the jarring which occurs when there's dissonance between what you're seeing with your eyes and what you're hearing with your ears. So for me, the prime example of this, I was talking to a research participant. She'd chosen to go into her child's bedroom to try and get some privacy. On the wall behind her were lots of lovely, happy Disney characters, but what she was actually talking about was horrific abuse. And I'm quite a visual person, so the contrast, I suppose, of that really stayed with me, of what I was seeing and what I was hearing about. I mentioned our interactions with participants have been longer, and participants seem to really appreciate the additional time offered, but this can take a toll on the researchers. So for example, one of my colleagues I spoke to in the day before, she'd done an interview that had lasted 2.5 hours. And her description was, I'm feeling utterly wired and wrung out, which is perhaps unsurprising given the length of the interview. But also people are kind of needing more of us at the moment. There's a bit of a slippage of the researcher role. We're used to providing kind of people with perhaps a little bit of signposting to support services if they need it at the end of the research interview. It'd be remiss of us not to. But at the moment, people just need a little bit more support at the end of the interview. They're asking advice, they're asking questions, they're genuinely asking about where they can go for support. And this is something that Emma mentioned. In usual times, most of our colleagues try to keep their work away from their home to try to maintain some sort of safe haven, I suppose, in their home environment that's kind of unpolluted by the distress or toxicity of the work we do. But during this time where work is being done at home, simply shutting the door on that room at the end of the day doesn't often feel like it's quite enough. And there's something about the commute too. Talking to my colleagues, they've talked about the commute is usually an opportunity to kind of reset and recalibrate almost their kind of thinking, their mindset, that sort of thing. And we've not really got that just kind of walking from the dining room into the kitchen now. So the headspace that's needed, I suppose, to kind of assimilate all that you've heard or been exposed to isn't really there just now. And I think the final challenge to mention is not having downtime in the working day. I'm fortunate enough to work around a bunch of people doing equally challenging work. And there's something about the interactions that we have in the corridor that mean that we don't have to talk about what it is we're doing, but we know each other is doing difficult stuff. So we kind of understand the place from which each other comes from, and that's not really the same necessarily with the people who perhaps you live with rather than with your work colleagues. And so those kind of peripheral conversations that might happen at work just aren't there. Next slide, please. In spite of these challenges, we're finding ways to continue doing the work, and there are certainly some practical strategies that we found helpful. So some are professional standard kind of techniques, such as, you know, writing notes straight after your interactions with participants, or debriefing with peers, or with the help of professional support, as Emma described. But what's working now for people? Well, I suppose we always think about how we pace our workload. I wouldn't tend to do more than one research interview in a day if I can, but I'm building in more pacing, I suppose. So trying to do interviews not every day for a week, or not doing kind of several days in a row of kind of in-depth analysis, because analysis can be just as tough as the interviews themselves. In fact, it can be more so, because you're almost kind of marinating yourself in it. The second is finding a way symbolically to kind of let the participants' emotional distress out of the room. I think so. This is where I've kind of drawn, I suppose, on my counselling practice. So I've tended to, when I see clients, I tend to open the window after I've seen them. I tend to light a candle, something to symbolically kind of let the emotions go, somebody else's emotions go, and let some kind of fresh air in. And linked with that, I suppose, is the next one is about providing cues to your brain about the difference between being at home to work and being at home to rest. So trying to kind of create a boundary where there isn't really one at the moment. So some of the things colleagues are trying is sort of changing your clothes at the end of your workday, taking a shower, going for a walk, even if it's just round the block, so that your brain gets the idea that work is finished and you're now kind of going home to rest and relax. And also, it's simply about increasing the ways that you look after yourself. You will know what works for you, whether it's doing yoga or Pilates, whether it's having a bath with candles, whether it's, you know, weeding the garden, whether it's baking. You'll know those things that work for you. And it's really about appreciating that self-care needs to be part of our job. It's not separate from it. It is actually part of being able to continue kind of sustaining the work that we do. And this leads me to a final thing that I want to mention, which Emma's already kind of alluded to. It's about not punishing yourself for feeling something about the work that you do. Our institutions and departments may have very particular academic ideas about us being objective, detached, needing to be unemotional as researchers. And I think we probably need some reframing around this. Researchers working with sensitive or traumatic issues, particularly if they're doing qualitative work, but it applies to quantitative too. We need emotions to do our job well. And I love what one of my colleagues said about recognising the importance of empathy in the type of work we do. Next slide, please. She said, we have to open ourselves up to feeling other people's pain. We wouldn't be good at what we do otherwise. So there's something about the necessity of being open and therefore feeling something of other people's pain and other people's emotion. And it's a case of, what do you then do with that? How do you then not take that away with you? Next slide, please. So the overall message from me is about being kind to yourself, about knowing yourself, being kind to yourself. And here are some of the links to resources which you may find helpful. There's some ideas about who to contact. There's some links to some more resources on the topic, some of which were shared in advance of today. And we've also included some details relating to domestic abuse specifically at the bottom. Next slide, please. But what we really wanted to do today, as well as kind of Emma and I share what we've learned, we wanted to hear from you guys to find out how you're doing, what you've been trying in order to kind of cope with the current situation, and what you might need either at the moment or what you might need going forward.
Thanks very much indeed, Alison and Emma. I'm hoping you can hear me now. This is Judy Hill from SWDTP, to those of you who weren't here at the beginning of the session. So a really, really interesting presentation, or set of presentations. We've had a couple of questions that have come in straight to me, so they won't be on the chat. And I will pose them now, if that's okay, Alison and Emma. Okay, so firstly, can you hear me?
Yep.
Yep. Thanks. So someone's saying thanks very much indeed for holding the seminar. So much of what the speakers are saying chimes with me, and it's very validating to hear what they're saying.
Good.
in this person's experience, the ethics boards are there to approve rather than to aid. And this person's felt they've had to show the problems and the solutions rather than ask for advice. And then they're sort of scrambling across the internet, hoping to make a good case and that they're going to be okay. Is there any advice you can give about how they can ask and engage with the university more on researcher safety, including emotional safety? This person's got really great supervisors, but they still struggle to ask for help and advice on anything really.
Should I take that one, as I'm the faculty ethics officer? So I think you're absolutely right, and that is partly why myself and colleagues who've worked in my area, and also other areas that are quite difficult, have moved into doing work in relation to ethics committees, because sometimes you can find that ethics committees ask certain questions that aren't actually the things that are going to be a problem. And so what we've been able to do is, because we know what some of the problems are, is actually ensure that the right questions are being asked. So what I would say is to be as open as you can. Actually, my experience, and it might not be the case for every committee, is that what we're looking for is for people to try and identify what might happen, what the problems might be, and then how they're going to deal with it. And you can't always get that right. You can't always account for things that might happen. But it's just about trying to be clear on that. And we would always ask in the researcher safety protocol, especially if it was a traumatic topic, what emotional safety has been put in place to protect researchers. And I think particularly at the moment, so when people have put in for amendments to continue work during COVID, we've then asked, well, okay, you may be doing research with a certain population who may be more likely to have experienced bereavement, for example. So how are you going to deal with that? What additional support are you going to give to those researchers in order to be able to stay emotionally safe? So if the individual who posed the question is a PhD student, I think it's particularly difficult as a PhD student. Yeah. Even if you've got really good supervisors, I think it's important that PhD students talk to each other. Yeah. I think it is important to have a community of researchers, whether they're at your own institution or others, which I think is why the Southwest Doctoral Training Partnership is a really good idea, because there may be your peers, maybe in other institutions. And you can pose questions, you can challenge ethics committees. If they are functioning like a dictatorship, then they shouldn't be. Yeah, I think some of us would be open if there are particularly bad examples where we can look at that.
Yeah, so I guess there's one thing I didn't quite cover in the question as well, and it relates to some of the things you've just said as well. So this person's saying that they don't feel that the guidance for supervisors and the supervisee relationship really covers this. So I don't know if you know of anyone.
I don't think it does. To be honest, I don't think it does, and I don't think this issue is covered in qualitative methods training either. So we're starting to do that, and we're starting to put lectures in that cover this, so that people start questioning how people can stay safe. And I think as well, for me, fundamentally, I think this is a really fundamental point, is that this kind of work isn't going to be for everybody. There are some people for whom this work will not be a safe thing to do, but your supervisor or your line manager is not the person who you can have that conversation with to work that out. And it might not, you might have the greatest desire in the world, you might be really committed to what you're doing, you might be really good at it, but it may be that it's just not going to be safe for you to do that. But you can only come to that conclusion if you've got an independent, external, clinical supervisory person to have that conversation with, and we never really recognise that. And I think, so that's not to blame the individual, but to say none of us have had that process, and that's not good enough. So it's not good enough for us now to go, well, we never had that, so it doesn't matter. What we need to be saying now is we didn't have it and we should have had it, and we need to change things to put things in place. So I'm very happy. I'll take that forward and ensure that we look at maybe some training for supervisors around whether they're picking up on this issue in the way that they need to be.
About having other structures is a really important one, though, because you do, as you said earlier, have a power relationship there, don't you? And there's a potential for people to get quite defensive, I think, around it, if they're too closely involved.
Yeah.
So that's really, really helpful. Okay. Oh, so also a question around how would you go about challenging an ethics committee? So someone else has said actually they find, I think this is their point, that they've actually found that they're, oh, well, I can't find it now. That
So
certain ethics committees that they've worked with have been really sort of welcoming and able and open to providing advice, but others maybe not so much. And how would you go about challenging?
So ethics committees are part of a broader research governance structure.
Yeah.
So there are people above. If you really genuinely believe that something's not been taken into account or something isn't accurate, then you can take that. So if in our faculty, if you go to your school committee, you've always got the faculty above, and then you've got a research governance team in red who can look at any queries around that and take advice and try and improve things. Sorry, Alison.
Can I add to this? So I have in the past straddled 2 different departments, and I suppose I had a choice really of ethics committees to go to. And I looked at both in terms of what I thought would be best for me in the research. So not who would give me the easiest ride to just kind of get it through ethics and get on with the research. I actually went to the ethics committee that was kind of better informed, and I knew would actually probably give me a harder time in terms of thinking about participant safety and my own safety, particularly emotional safety, because I wanted that kind of sounding board. I wanted to know that what I was doing was likely to be ethically sound. So it may be, it depends on where you work and what department you work in, and whether you have a kind of a multidisciplinary project. It may be that you've got an opportunity to actually choose a different ethics committee than the one.
Right, that's a good point.
Another
question around ethics committees. So this person's saying that they think that ethics committees often focus on researcher safety and researcher safety protocols at the point of data collection. How can these committees better ensure the safety, health and well-being of researchers undertaking this type of research 1 month, 6 months, or even later, for example, after the study has been completed?
So again, I think that is, that needs to be in the protocol, but then a protocol is just a piece of paper. That is then, I think, about that broader discussion about what clinical supervision is and why some of those of us who do this work don't get it. We don't get it. So, we're all in the same boat. Well, we do if we pay for it ourselves often. Some of us do get it, actually. If you've funded well, you can build it in. But for most research projects, that isn't financially feasible. But we do need to be asking the question of why that is allowed to happen. And I think because you do need that, and you need that conversation beforehand to look at how you're going to cope, and you need that throughout the data collection. But as Alison said, analysis can be even worse. Yeah. And you maybe then. So I've been reading some interview transcripts this week for a project that I did 2 years ago. So I've not got a team around me doing that. I'm looking at those interviews, but it brings stuff back. So again, it's about long term, how as employees or as students at a university we can be supported to be safe all the time. It isn't just when we're in that particular moment. And it's not good enough, I suppose, is what I would say. It isn't good enough, and I don't have an answer to that, but we are looking at ways that we can try and get policy changed from funders, but also across universities to try and deal with that.
Yeah, thank you. Okay, another question I've had. So to what extent have you managed to sustain the sense of community during lockdown, now that you're not meeting face to face? And I guess what have you done to try and mitigate those issues?
So we've been doing a variety of things. We have been meeting regularly via Zoom. We have what we've been loosely calling a cafe once a week for kind of half an hour, so that people can kind of pop in and pop out and just kind of say hello amongst our team, with the idea that we're not talking work, we're just kind of talking what box sets people have been watching and what they've been overindulging on food-wise. But also we've started, so at the beginning of this week, we've started thinking about ways that we could meet in socially distanced small groups, kind of in a park on a nice day, so that we can actually see people And we've also been putting out a request, I suppose, to the university for those of us that would like to return to our offices, to kind of, for two reasons: to increase the boundary again between work and home, but also to perhaps see our colleagues a bit more, that we could be considered as people who do need to return. So yeah, those are some of the ways, certainly in my research group, that we've been trying.
Okay. Have those been responded to yet, those requests?
It depends which department you're in as well, because access to buildings doesn't seem to be uniform across even our institution, so I suspect it's different across the Southwest Partnership. But
yeah.
I think there is an expectation that because you're a social scientist, you can do that anywhere, and clearly you can't. But the other issue, I think, is, you know, we have colleagues who have children, and, you know, they don't necessarily, even if they can have a conversation from home where they can hear somebody, they can't do an interview like this when there's children around, because it's not appropriate. So I think I think we have to start from the position that it's not going to be feasible, possible for everybody to do this, to work at home, and then when it's not, what can we put in place? So I think there's starting to be some recognition that, you know, yes, labs need to open. If you're doing an experiment in a lab, you can't do it at home. But actually, for some of us, if our employers want us to be safe over the long term, then we need some flexibility so that we can have those things put in place. So we are pushing for that. And that also applies, I think, to PhD students. So I know in our school, we've been having, each of the research centres has been having meetings with PhD students to look at what they need and what we can do, and trying to put groups of students together so that they can support each other, but also looking at what we need. Can we have a day when certain people can come in a socially distanced way, so that they can, at least on that one day a week, have some human contact to do that? So we're raising those questions and hoping that it will happen.
Yeah, that's really helpful. Okay, another question. So for both of you, how did you maintain your objectivity while reporting findings or during the whole procedure?
So in terms of the data collection, data analysis, I suppose because we're trained to be researchers, and in terms of the data, it is about being as objective as you can be, acknowledging the biases that we bring to that data, and also acknowledging that if we don't deal with how this stuff affects us as individuals, then we are inadvertently affecting the objectivity of the research. So I think, you know, again, the Centre for Gender Advanced Research has, we should have celebrated 30 years during lockdown, so we couldn't, but, you know, we've got 30 years experience of doing that and trying to ensure that we have that objectivity in terms of the data and evidence, and that it's presented in an appropriate way, an accessible way, but also recognizing that, yeah, it does impact on us, that we're not robots, I suppose. Yeah, I don't know, Alison, if you want to say anything else on that.
I'm just thinking, so there was one paper that we submitted where they actually asked us, and I was quite impressed with this, the journal asked us to describe a bit about our reflexivity. So they were asking us to describe from what perspective we'd looked at the data, in terms of who we were, what our lived experience might have been. And I was sort of surprised and pleased at the same time. And also kind of like, how does that feel? So I had some mixed feelings about it, but it was quite interesting because they were assuming that in a way that you can't be objective, or not entirely objective. We all come with our life experiences, and, you know, we all look at the data through a particular lens. I will draw out different things than somebody who's had a very different set of life experiences. And you can reduce some of the kind of potential bias in there by getting people to, you can have a second person who will extract the data and a second person who will kind of look at the analysis and code and all of those kind of things that you can put in place. But at the end of the day, you're still bound by the kind of characteristics that the people who've worked on the data have. So I guess that paper, that journal was asking you to just be very open about the lens through which you were looking at the data, so that other people could decide for themselves whether they felt they would have made the same sense of the data as you had.
Thank you. Okay, there's one more question. I've just asked for a bit more detail on it, but I have a question, if that's okay.
Yep.
I'm interested, two questions actually. Others, do feel free to ask your questions in the meantime. We've got about 5 more minutes, I think. So have you made any progress in terms of lobbying the funders? So the paper in the Times Higher talks particularly about that, doesn't it? I'm just wondering if you've made any progress and how we can work together to try and lobby for that, and what sorts of things would you be asking to cost into projects and so on.
Yeah, so I was due to give a talk at Westminster with various of the UK funding institutions during lockdown, so it didn't happen. It was postponed, so I'm hoping that when that's rescheduled in some way that we can feed into that. We're harassing our colleagues in red, Jude, to push this on our behalf as well. We're having conversations through the research governance teams about looking to the university about what we can do for that. My preference is that it shouldn't be something that you're penalised for financially for building into a bid, because then you have to remove other things that will create additional stress because you've got to do more work. I think if you're doing some research on a traumatic, sensitive topic, you tick a box and say that, and if you get that funding, you should be automatically given a 2% ring-fenced budget on top, in addition, that can only be used for clinical supervision. That would be my shout, really. It's quite simple and would make a massive difference, I think.
Yeah. Thank you. And my other question was, so one of the papers that we shared with everyone in advance was written by, it was a blog, I think, actually, written by Helen Beckett.
Mm-hmm.
And she talks about a survey on researchers' welfare that was due to be launched in March. I don't know if you know any more about how that's gone, or if there's any more updates on that.
I think it's recently closed, so hopefully we should be able to have some kind of updates from that in the near future.
It would be really great if you could share those with us, and then we can share those with the group here.
Yeah,
great.
No, I think it's a good idea. And I think maybe the university could have a bigger conference on this to get people to talk about it and have discussions about it, and get different research ethics people to come and listen and talk and understand both the difficulties but also the additional frustrations that come when people do get it and perhaps are being asked questions that then they find quite frustrating to find. So maybe that's something. I don't know if I saw Liam on earlier. Maybe that's something that the research governance team could look at supporting with the relevant PVC. I think that could be really important, both for postgraduate students but also for staff as well. I think that would be really important. Yeah, that's Liam. Liam said he's going to look into it. Sorry, Liam.
Thanks, Liam. So Liam works for Bristol, but of course many of these things will apply across. So we can work with you. Okay, I mean, I think we're running out of time. Thank you so much for. I was going to put my video on again. Thank you so much to both of you again for your fantastic presentations. I suspect we shall have some more questions coming through. This will have triggered some thoughts amongst various people. And so if it's all right with you, we will collect those together and then share them with you, and we will get back to everyone with a sort of distillation of the questions and the answers, as well as the recording.
I think it'd be really good, Jude, as well, if that goes up the universities as well, because I think this is the kind of thing that, it shows people how important it is. So that I think that would be really helpful as well.
No, absolutely, and I know that not everyone's been able to, that registered has been able to be here today. So there's the bigger group here, but there's a bigger group out there as well, and in the future as well. So absolutely, definitely happy to do that.
Right.
Okay, and actually, Helen, could you just go on to the next slide? There. So just a reminder again, so as Alison mentioned earlier, if you are experiencing difficulties yourself, there are some support contact details there. And yes, we will work together to try and improve things for you as researchers, as PhD researchers and beyond. I think that's probably all for now, but thank you very much to everyone again, and take care, and we'll be in touch. Thank you.
Thank you. Thank you, everyone.
Oh, there's one last question, but I will reply to that later. Thank you.